We're here in Dape community in a bid to honor our mother, Funmilayo Florence Babalola.
This project is very close to our hearts because it addresses two silent killers in our community, hypertension and diabetes.
Today, the FFB Foundation team is on an outreach. One, to sensitize people about public health, but also personal health, ensuring that people are able to know what is their current state of health.
My name is Babalola and I'm a registered nurse by profession. I feel excited. I'm actually a little bit overwhelmed by what I've seen. I haven't participated virtually before, but the opportunity of being able to participate in person has been extremely overwhelming for me. Being mindful that this is something that is being done for my mom, in honor of my mom, I should say. As a person that she's been, she made a lot of impact in a nuclear family. Now this is more impact across, to impact more people, more lives. So I'm really, really excited about it, and it's a privilege to be here.
We have organized ourselves to provide free medical intervention in this community and ensure that people here can get health care rather than paying from out of pocket because of the current economic challenges.
Many people have these diseases and they wouldn't know about it until serious complications like stroke, kidney failure, heart diseases, blindness have already set in. Early detection is key in saving lives.
I want to sincerely appreciate Funmilayo Florence Babalola Foundation for coming to our aid in terms of health. We know the challenges we are having in this country is health challenges. There are no health facilities in the country. Even the ones that are available cannot be accessed by poor masses. So we have to appreciate you for coming to check the health of my people in terms of high blood pressure, blood sugar level, and other health challenges.
Gaskiya dama ina tunanin da cewa ina ne zan samu kudin da zan je in test domin ina dan jin jiki na min dan wayansu nauyi haka, sai kuma gashi Allah ya taimaka wayannan bayan Allah su zo sun taimake mu sun mana test, yanzu na gane abun da ke tare da ni.
I think it's absolutely critical that NGOs like FFB should undertake in this kind of activity in a vulnerable community like this. I can assure you that if you take data, if you check your statistics, a lot of people in this community may not have gone to any health facility in the last 5 years. And not because they don't want to, but because they can't afford it. So you can't imagine what it would cost them to do a blood pressure check or to have their blood sugar checked at this time. Go to a local pharmacy and try to find out the cost of a kit to carry out blood sugar test. Then you better appreciate, why activities like this, is very important in a community like this.
FFB is modeling what works and what kind of lessons others can take from. And I believe that this is also important because government itself cannot do it all. In this community, they don't even have a functional primary health care center, let alone healthcare workers. So if we don't reach out to them, no one would reach out to them. And for us, this is a little way we can contribute back to society as FFB Foundation. And we hope that others will take a cue from it.
Taba na yi wannan gwaji ba, amma yau FFB Foundation da sun zo gwaji, sun yi gwaji gaskiya ban taba yin ba, amma na sun yi gwaji na ji daɗi gwaji, ban iske kaina da matsala ba, ina gode.
FFB is a very good something that you came around my place, my area where I stay. So it's a very good thing to check off our blood pressure and other things. There
are so many lay people that don't understand the basic in health. just basic health care, like basic questions. Some of the examples, like I'm specific that I ask is, what was the last blood pressure reading? They don't know such information. And I think that's something that in this day and age, with the way our healthcare system is working across the world, it is important that people are able to say, oh, this is my weight the last time I checked, this is my blood pressure the last time I checked. Because that's how you keep track, that's how you know when things are changing.
It's very important that people detect these things early to prevent complications from arising. So the Funmilayo Florence Babalola Foundation is actually carrying out this outreach because we believe that early detection saves lives. When people know their values or their numbers early, it will help save and prevent complications from arising.
Put together the 7,000+ civil society or NGOs that we have in the country, I don't think they can do what government can do. We've got what is called National Orientation Agency and quite a number of agencies under the Ministry of Health. So I think it will do us good if we get to sensitize people about this form of diseases, and not just sensitize them about it, tell them about lifestyle, tell them about how they can avert that issue.
I think the government, beyond just providing legal and regulatory framework and policies around healthcare, is to work with organizations like FFB, because for us, we're committed to reaching underserved and hard-to-reach communities. And government cannot be everywhere, but with partnership, and the Sustainable Development Goal 17 talks about partnership for the goals. With partnership like this, we can reach other community members, and particularly citizens that are in dire need of healthcare intervention.
I see the government as a massive vessel, and while I see NGOs like lightering vessels. The larger vessels cannot go into the creeks, but the lighter ones can go into those creeks. And so the government should see local NGOs as that lightering vessel that can go into the creeks to meet, people in communities like this.
FFB Foundation! Mama lives forever! FFB Foundation! Mama lives forever! FFB Foundation! Mama lives forever! FFB Foundation! Woo!